Welcome back to Pharmacy Review. Today, we're covering Utah's controlled substance regulations. Controlled substances require strict oversight, and Utah has specific laws governing how they're prescribed, dispensed, and monitored. Regulating controlled substances helps prevent misuse, protects patients, and ensures pharmacies follow state and federal laws. So, let's dive into Utah's 2025 controlled substance regulations, starting with drug scheduling. Disclaimer: this channel provides educational content on pharmacy law, summarized by artificial intelligence. While efforts are made to ensure accuracy, information presented here may not be comprehensive or up to date with the latest legal developments. This content is for informational purposes only and does not constitute legal advice. Viewers should consult a licensed attorney or qualified professional for specific guidance related to pharmacy law and regulations. The creators of this channel are not liable for any actions taken based on the information provided. Always verify details with authoritative sources such as government regulations, professional organizations, or legal experts. Section 10. Controlled Substances. In this detailed session, we're exploring the legal framework surrounding controlled substances in Utah, a cornerstone of pharmacy practice where regulatory compliance, clinical judgment, and patient safety intersect. We'll cover everything from prescription requirements and electronic prescribing mandates to PDMP obligations, refill limitations, licensing, and more. Drug scheduling in Utah. Utah adopts the Federal Controlled Substance Schedules I through 5 as outlined by the DEA. There is no state-specific Schedule 6, which exists in some states like North Carolina. You can view the most current list of scheduled drugs on the DEA website. Prescription pad requirements. Utah does not mandate special tamper-resistant prescription pads for Schedule II through 5 prescriptions. However, DEA requirements must still be met, especially for Schedule II. Prescription validity timeframes. Expiration periods. Schedule II. Valid for 30 days from the date issued or date intended to be dispensed if written separately. Schedule 3 and 4. Valid for 6 months from the date written. Schedule 5. Valid for 1 year, unless renewed. If a Schedule II prescription is not presented to a pharmacist or in turn within 30 days of issue, or dispensing date if different, it may not be filled. Refill limitations. Refills are strictly regulated. Schedule 2. No refills allowed. Schedule 3 and 4. Up to 5 refills within 6 months. Schedule 5. May be refilled as directed by the prescriber, but only within 1 year of the original issue date. Quantity and day supply restrictions. General limits. Schedule 2 medications may not be dispensed in amounts exceeding a 30-day supply based on the prescribed daily dosage rate. Opioids for acute conditions. Schedule 2 or 3 opioids prescribed for acute conditions may only be filled in a 7-day supply. This restriction does not apply to medications prescribed for complex conditions, chronic conditions. These exceptions must be documented in the patient's medical record. Note: pharmacists are not required to verify if a condition is acute or chronic. Prescriber licensing requirements. Every individual or entity that manufactures, distributes, dispenses, prescribes, or performs research on controlled substances in Utah must obtain a Utah Controlled Substance License, a valid DEA registration. This includes prescribers, pharmacies, researchers, and even veterinary practices. Electronic Prescribing Requirements (EPCS). As of January 1, 2022, all prescriptions for controlled substances in Utah must be electronically transmitted unless an exemption applies. Exemptions include prescriptions for patients in assisted living facilities, long-term care facilities, correctional facilities, veterinary prescriptions, Veterans Affairs dispensed medications, temporary technical failure at prescriber or pharmacy, emergency situations. All electronic prescriptions must comply with federal EPCS standards, ensuring authentication and data integrity. Phone, fax, and emergency prescriptions. Emergency oral prescriptions for Schedule II drugs, allowed only during true emergencies, must be immediately reduced to writing, must be filed using appropriate DEA-compliant forms. Faxing and phoning of Schedule 3 through 5 prescriptions is permitted, provided all required prescription elements are documented. Prescription Drug Monitoring Program. Utah mandates that every pharmacist dispensing controlled substances must submit data to the Controlled Substance Database, CSD. Reporting frequency: real-time submission, or 24 hours or by the next business day, whichever is later. Data must include all controlled substances dispensed, any non-controlled substances designated by the division, prescriber, patient, quantity, dosage, pharmacy, etc. Non-resident pharmacies, mail order or central fill, must also report multiple prescriptions and post-dating rules. Issuing multiple C2 prescriptions. Allowed under the following: no more than 3 prescriptions at once. Each RX must be limited to a 30-day supply. All RXs must be dated on the day issued. Future fill dates must be clearly noted, e.g., do not fill until. Post-dating is prohibited. Prescriptions must be signed and dated on the date of issue. Partial filling of Schedule II. Permitted if requested by the patient or prescriber. The patient is in a long-term care facility, terminally ill. Fills must comply with federal DEA rules, and all partial fills must be
documented.
Filled within 30 days of the original date. Emergency fill protocols. In emergencies, a pharmacist may fill a Schedule II prescription on the basis of an oral order, but must reduce it to writing immediately. Use approved DEA-compliant forms. Ensure the written prescription is received within 7 days, or per division rule. This is typically reserved for situations where delay would harm the patient. No alternative is readily available. Out-of-state prescriptions. Pharmacies may fill out-of-state prescriptions for controlled substances if the prescriber is licensed in their own state. The prescription meets both federal and Utah requirements. Out-of-country prescriptions for controlled substances are not permitted under federal law. Now, let's discuss a topic that is more relevant now than ever: responding to overdose and opioid dependence through the tools available to pharmacists under Utah law. In this session, we'll walk through the legal framework surrounding naloxone dispensing, explore standing prescription drug orders, and touch on the current regulations, or lack thereof, related to Suboxone administration. Let's begin by addressing naloxone. Naloxone Dispensing Authority. Under Utah's Pharmacy Practice Act, pharmacists have clear authority to dispense naloxone, or any opiate antagonist, under a standing order, without needing a patient-specific prescription. So, what does that mean in practice? A licensed pharmacist may independently dispense naloxone under a standing prescription drug order established by a physician, state authority, or governing body, without a patient-specific prescription issued at the point of care. This means a patient or their caregiver can walk into a pharmacy and receive naloxone, no questions asked, and no new prescriber involvement needed at that moment. Standing prescription drug orders. A standing order is a legal and regulatory mechanism that allows a pharmacist to dispense naloxone proactively. It's not tied to a specific patient at the time of issuance, but instead functions as a blanket prescription, typically authorized by the Utah Department of Health, a collaborating physician, or a statewide protocol approved by the Division of Occupational and Professional Licensing, DOPL. This is a key tool for pharmacists working in community settings, those conducting outreach programs, or pharmacies wanting to stock naloxone for walk-in, no prescription needed distribution. Most commonly, naloxone is dispensed in the form of intranasal spray, e.g., Narcan, auto-injector pens, intramuscular kits with syringes and vials, counseling and education responsibilities. Although Utah law authorizes naloxone dispensing without a prescription, pharmacists must still offer patient counseling, provide clear instructions on administration, educate on recognition of opioid overdose symptoms, encourage emergency medical follow-up. It's also common and recommended to provide written materials or demonstration videos when dispensing naloxone. Legal protections and Good Samaritan implications. Utah law also provides liability protections to those who dispense or administer naloxone in good faith. Pharmacists and pharmacy interns are protected when acting under standing orders. Patients or caregivers administering naloxone during a suspected overdose are shielded from criminal or civil liability if their intent was to save a life. This is designed to remove the hesitation and legal fears that could otherwise prevent timely action in an overdose situation. Suboxone, buprenorphine naloxone administration. Let's now address Suboxone, a critical tool in treating opioid use disorder, OUD. Current Utah law. At this time, there are no state-specific administrative rules under the Pharmacy Practice Act that define or govern Suboxone administration by pharmacists, or expanded access models such as pharmacist-initiated therapy or collaborative practice agreements. While Prescribing Authority for buprenorphine now falls under the general DEA registration, thanks to the removal of the X waiver in January 2023, Utah has not explicitly expanded pharmacist scope to include the direct administration or initiation of Suboxone therapy. That said, pharmacists remain essential in dispensing Suboxone, educating patients on usage and adherence, counseling on interactions and risks, and supporting MAT, medication-assisted treatment, programs as a whole. If you're a practicing pharmacist in Utah, you play a vital role in reducing harm, educating the public, and providing access to life-saving interventions. Keep naloxone stocked, stay familiar with standing order procedures, and ensure your entire team is trained to counsel patients confidently and competently. Thanks for watching Pharmacy Review. If you found this video helpful, don't forget to like, subscribe, and hit the notification bell to stay updated on all things pharmacy. Got questions or suggestions? Drop them in the comments below. Until next time, take care and keep thriving in your pharmacy journey.